So we feel that, of course, we do what we do on behalf of our patients. And it's important to have feedback from them to see how we're doing. We've been talking at great length over the last 2.5 days about what we do for them, how we do it, how to better do it. But I thought it would be very important, and in fact, I believe this was Dr. Torregos's idea to have this session today, to hear from patients themselves about what it is like to have a coronary bypass operation. And there are multiple iterations or types of coronary surgery, and we're going to hear from 2 different patients today. Unfortunately, Dr. Bakeen's patient has got a flu. It turns out that having coronary bypass does not prevent communicable illness. Not 30 years later. You're too young to have done that operation 30 years ago. You didn't do it, okay.
No, he's just a patient, and happens to be Dr. Maddox, Ken Maddox, for those of you who don't know him, runs the trauma service at Ben Taub and runs the biggest trauma meeting in the world in Las Vegas. He's also a heart surgeon, and he's a very vivid personality. He would have been a perfect addition to this panel. He sends his apologies because he developed a really bad flu. I didn't do his surgery. Mike Reardon did his surgery, and I was a resident that rounded on him. He was out of the hospital in 4 days, and he said that he went back to the hospital and started practicing again within 3 weeks. So those people, and he had a full sternotomy, by the way. So for those who say that a sternotomy would set you back, crack your chest, and you'll never be the same again, he said that he's full of energy. And then he gave me 3 examples of people who had a sternotomy and did well. Our past president, Bill Clinton, Regis Philbin, and who was the third celebrity that had it?
Schwarzenegger, but he had 2.
Schwarzenegger had 2. And he said that they all did amazingly well.
Yeah.
Gianluca, please lead the way with your patient, please.
Thank you. No. And we are here with all, and thank you so much. So, Mr. Kenneth Diego, can you please tell us a little bit, what do you do? How's your life? This is how I always start in my office. I never ask immediately. I always ask about the patients. Tell us a little bit about you. What is your relationship with New York City? What do you do in life?
Well, I'm a grandpa. Have a nearly 3-year-old granddaughter. I married. My lovely wife is sitting right there, Joni.
Congratulations.
Thank you. 2 daughters, grown, and I recently moved from the New York City area, but I lived in northern New Jersey, and I worked. My career was in television production, still is, slightly reduced basis, but I'm one of the directors on Sesame Street, and then I've had kind of a bifurcated career within television production, which is directing Sesame Street and working on other family programming, and then serving as a lead associate director on live event programming, award shows, the Tony Awards, the Oscars, NFL honors, shows like that are live events. So a mixture of a lot of stress and excitement, all in the same ball of wax.
I love this, and we always start like this in the office to know who you are, where you come from. Remind me a little bit, how did you arrive in my office? Did you have symptoms, or this one was checking your coronary arteries for yourself?
This was kind of a shocking process for me, a really eye-opening process. Started with my primary care physician in August, and I have nearly 0 symptoms in terms of pain or the typical heart problem symptoms. I would need to take a break during my yard work for about 10 minutes and then pick up and continue. That was kind of my warning. And I thought, I'm 69. It's age.
You have been good.
Yeah. So
So we have some slides. If you can put up the slides, please. There is a presentation for him. I put the cath. So you do your test. You get your left heart cath that we can see right now. I just uploaded the presentation. Yeah, this is your right coronary. And someone tells you there is blockage in your coronary
Yes.
arteries.
It started with a test I paid for out of pocket.
You even pay for it.
Yeah, because the insurance didn't cover it, which amazes me, but probably because it leads to more tests.
Yeah.
But it was the calcium score,
Calcium score.
and it came back very high, and it targeted 2 arteries that said they were well above 400.
I ran the slides here very quickly. So this one is the right, okay? This one, and you see, this one is the left. So this one means a lot for us, Kenneth, not much for you, but and you guys can see there is an LAD, complex diagonal, very tortuous coronary artery disease, and then there is a CTO of a PLB, and you see better in other view. Here you see the LAD, and you see here that it's coming up as a ghost on the left side. So this is the surgery and this is the last form of medicine that gives you the formal report that you can share with patients and you can share with cardiologists. So you are now in my office and someone with an Italian accent and a guy, this is a pair of glasses, tell you that you need a sternotomy bypass to perform bypass grafting. How was your reaction? What you thought back then, and how long it took from the time in which we see each other for the first time to the time of the surgery?
3 weeks
3 weeks.
for our first meeting, and
Yeah.
the initial shock was all of these tests, including stress tests, led to catheterization, where I thought it'll be fixed at the right there with the stents. And I came out of that process, and the surgeon, Dr. Shapiro, said to me, stent isn't really going to do you much good in the long term. You really should get bypass surgery. I did not insert any stents. I took lots of pictures, videos, and my assessment is we're going to give you to Dr. T for bypass surgery.
So we did off-pump Capstan 4, Lita to LAD, short segment of Rita to that diagonal, that is basically first almost a ramus, and then a Rita inside to extended radial sequential PDA and DOM3 that comes here as a ghost. This one is for us. What do you remember? This is happened October 2025.
It was very early October was our first meeting, and then the surgery was the 24th.
10/24 here is
Yes.
written here in the report. So this is, you are now basically almost 2 months out of surgery.
Yes.
What do you remember? First days of the ICU. Do you remember the intensive care unit or no?
I remember seeing my wife and daughter I didn't feel conscious until I was in the private ICU, which was an amazing thing
Yeah.
in itself. And then very groggy. And in terms of pain, it was the tubes that were still in my chest, I guess, to clear the fluids. That was the most uncomfortable thing. The rest, I felt pretty calm and cared for. And once that pain was addressed, my first 2 days were quite good, actually. One thing I appreciated was every member of the team made sure I knew their name, made sure they knew what they were going to do for me at that moment, and then they were continually asking me about my comfort level, and that just made everything very smooth. And I remember having a very good night's sleep the first night.
Yeah.
And the second day, when I was really starting to get up and walk, I felt pretty good. And then I guess as the pain returned regarding the tubes, and that became the biggest issue the next few days, was addressing the discomfort of the tubes.
Of the tubes.
Yeah.
Then the tubes come out, you go home. How was it? You're now at home. Your wife is all worried about, did allow you to pee with the bathroom door closed for you? Because I know that sometimes everybody's worried, checking if the man is still alive in every minute,
Yeah.
in everything.
She
Then they
was-
say why men get depressed after our surgery, because I cannot even pee with the door bathroom closed. I mean,
Well,
I
that
get
didn't
depressed.
bother me, whether I left it open or not, but I knew that there was always another pair of eyes
On you.
watching me. And
How did it go at home?
what's that?
Yeah, how did it go at home? The first week, the first day, you
Yeah.
are now day 5, day 6, I'll send
I
you home.
think there was a certain level of exploratory uncertainty, I'm going to say, because all of the things that were taken care of in the hospital were now just between my wife and myself. Yes, we sort of felt like it's almost like coming home with a new baby, really. But then things started to fall into place. Some things I learned quickly that I could do on my own. Some things I learned quickly, and Joni offered to help me. She was always ready to step in, and simple things like putting a shirt on, pulling a shirt over your head. She would help me with those things because of my limited use of my arms, and then protecting my chest area. So that was a transition until we started to get the home care, the nursing visits,
nursing visit.
and the PT visits. Those gave us little landing points each time they came to. We accumulated questions, we would ask them questions, and then they would help us understand different things.
How's the sternum? Do you feel it? Is something that we are always worried. Patients always
Yeah.
are worried. If I tell my dad he needs to have a chest open,
Yeah.
like he is. How was the sternum? How do you feel right now? You are 2 months.
Well, actually, I'm a little past 6 weeks.
6 weeks, actually.
But I'm still aware of like a tightness, but I would say the tightness was wider a few weeks ago, and each week it kind of feels like it's migrating to the center. I still feel a certain tightness here, but it's not pain, it's just, and my breathing as of, I'm going to say, 2 or 3 weeks ago has expanded greatly. Like I feel almost at the capacity I was before surgery. So
Yeah.
that's,
Luca, sorry to.
Please.
May I ask? So thank you, sir.
Yeah, you're welcome.
Thank you very much for coming to our meeting. We enormously thank you for doing this. I want to try and explore, because if, depending on which part of the world you're in, you could have been offered stents, you could have been offered nothing, you could be offered coronary bypass grafting, unfortunately done by an expert. But what I would like to explore with you, so if you are in the UK and you have the disease you have, the chances of you getting the right treatment are very, very high, because all decisions on treatment have to be agreed by a team of expert doctors. But in North America, you're unfortunately largely dependent on the whims and the conflicts of interest of cardiologists. So they say, I'm going to treat you however I want, and I won't even ask the expert opinion of Dr. Tori Grossav. So can you please take us through how you got to the decision to bypass grafting as opposed to anything else. So who advised you? Was it your own personal information by researching Google or whatever? So how did you get to that decision? And thank you very much
Yes.
for coming to
Yes.
our conference.
Yeah, well, once I ended up at Lankenau,
Yeah.
I felt like I was, it wasn't
So-
just the one individual, it was.
Sorry
yeah,
to
yeah,
interrupt
yeah,
you.
Yeah.
So what happened with you initially?
Oh, how did I
having
get
the
to there?
test, And
Yeah.
how did you get to Lankenau?
Okay, so our move from the New York area, I picked up a new primary care physician. I consulted with my older daughter who had experience with childbirth, and she highly recommended the Mainline Health Organization umbrella.
Yeah.
We were comparing other medical organizations, and she highly recommended them. I did some research online. I looked at some reviews. I mean, it's very sketchy, but then I decided we're going with Mainline Health. I then needed to find a PCP who would accept new patients, which is a game in and of itself. But I found one. He was very close by. I went to him. He was very attentive. I'm going to say he was much more attentive than the PCP I had for 25 years before I moved. And he just pointed out to me, he said, you don't seem to have symptoms. This doesn't bother you.
Yeah.
The statistics, your height, your weight, the length of time you've been on statins, you're on blood pressure medication and it was recently increased. Statistically, you have a 1 in 5 chance of a heart event. And he said, that to me is too high. And I would recommend this calcium test. So that started
May I
the whole
make
cascade. Yeah.
two very quick comments? 'Cause,
Yeah.
First, I think you said you're 69.
Yes.
You look fantastic for
Oh, thank you.
69, so congratulations.
Thank you.
But the second thing, what we do in the UK is great. So you got to Dr. Torregrossa by
Yes.
what to me sounds like a very random process. Because
I think it became less random
as you
as I followed the path.
Yeah.
Yes.
So what we have in the UK is a system whereby we have a great health team meeting. So if you came to my practice, your case would be assessed by 10 very senior doctors, both in non-intervention,
Yes.
in intervention by cardiologists. And
David,
cardiac surgery.
sorry to stop you, but this is how it happened. This is exactly how it happened. So we did CT coronary, CT calcium score, left heart cath, and was discussed at the heart team. The chief of the cath lab did his cath, Dr. Shapiro. He called me and told me sternotomy CABG is the way to go, and that's what we offer, a sternotomy CABG. And now we are here 6 weeks after.
Yes.
So last question, we have another patient. We want to have a little bit of a understanding. How do you feel now? How I want also to say that we close with plates, by the way. All of my BIMA are closed with plates. And you see that I don't have any financial disclosure, but I really believe in rigid standard fixation, particularly for BIMA. And the memory for you is the chest tubes, seems,
Yes.
and some tightness
Yes.
right now. How did you came here? You took a cab with your wife. What did you guys do? You came, how's going up through the stairs? How's your daily life right now, 6 weeks after?
Daily life is good. It's improving. I'm optimistic that I will actually achieve better health than I have been at, a level I have been at for, let's say, 2 decades before the surgery. I started cardiac exercises.
Yeah,
Yes.
cardiac rehab. Yeah.
We're now at a hospital
Yeah.
facility, and my exercise is guided and measured, and I just started using my arms again, which feels
Finally.
really good. And so I'm very optimistic, and
Good.
I'm looking forward to. I feel pretty good.
Yeah. Do you feel better or not than before surgery? Do you feel like before you didn't have symptoms? So you can tell me, I felt actually better, I didn't have this pain. What do you feel respect of before surgery? You are a tough cookie for us. Patients
Yeah.
asymptomatic are way more difficult
Yeah.
to treat. It's easier
Yeah.
for us to have the patient who have a big pain and say,
Yeah.
doctor, thank you for saving my life.
Well, the things I notice right now, I don't think I'm quite at the energy level I was.
You were good. Good to
But
know.
I'm looking forward to more. But there are certain twinges, I'm going to say, that I am not feeling that I did feel before,
Before.
in and around the chest area. So
It's cool. He was not asymptomatic, probably.
Yeah.
Exactly. Faisal, please intercept, or if you have any question, if you have any comment, and then I will get a little bit of time with Mr. Verissimo.
Yeah, well, it's interesting to hear your perspective. What strikes me is that you guys navigate blind. I mean, yes, they give you a pamphlet after you get discharged from the hospital, but it doesn't cover every aspect of life. What was the most useful resource for you to understand what you need to
Very
do?
good question.
And did you wish that there was something that we could offer as a medical community, as your surgeons, that would have made your experience more clear and the path kind of straight and known to you?
before surgery or
After the surgery.
After surgery, I got information in stages. So there was kind of a discharge orientation, I will say, which was a load of information, and you get a whole lot of instructions on paper, but you have someone taking you through the instructions. Then we're kind of released to your home. And that first day, I would say, was trying to reorient, right? Until we had the first visit from the visiting nurse. And then that person kind of went over everything again, and then would notice things and start to comment and take me through the process. And I would say, and I had a visit every second day, I would say. And each visit from a nurse or a PT would basically reinforce those instructions, pretty much. And sometimes they would bring me additional instructions. So it happened in stages. It wasn't, and it happened in a good way, because it kind of, you know how sometimes you're more focused on information when you really need it. So I would say we got good information at the right times. Yeah, but the home care was an important element. If we didn't have that, yeah.
Well, thanks for sharing your experience. We really appreciate it. And from what I hear, it's only going to get better for you.
Yes, I'm a Cabbage Patch Kid.
Stay with us, and I get a little bit the microphone. Dr. Pascas.
Thank you. And thank you, Mr. Diego, for joining us. It was really great to hear your story. Congratulations on your excellent early recovery. I'm not surprised. Dr. Torgos is a superb surgeon, and you're having an outstanding recovery. I'd like to tell you a little bit about the gentleman who's been sitting next to me here, who is a patient and a friend. He had a really very different experience getting to a heart operation, Mr. Diego, because these are my disclosures. If you do an AI Google search on Verissimo Costa runner heart patient, this is what pops up. And you can see that in 2018, while running along his usual path in Riverside, Mr. Costa suffered a cardiac arrest and subsequently came to our hospital unconscious and actually comatose for several days.
but later recovered. And
Back here on this Marathon Sunday, now the story about a second chance at life for a man after suffering a heart attack. 3 years ago, Verissimo Costa collapsed and died during a run near the West Side Highway. Now he'll run the NYC Marathon today with the heart surgeon that helped save his life. Here's Sandra Bookman.
When is a jog with a friend more than just a jog? When your running mate also happens to be the surgeon who saved your life.
I have no recollection, actually. They say that I just collapsed.
3 years ago, Verissimo Costa collapsed as he jogged along the Hudson River. In fact, doctors say for a few minutes he was clinically dead. But some passing cyclists began CPR, and responding EMTs got him quickly to Mount Sinai Morningside and into the care of Dr. John Puskas, chairman of the Department of Cardiovascular Surgery there. His innovative heart bypass technique gave Verissimo a new lease on life.
It gives them artery grafts instead of vein grafts from the legs, so there's no incisions in the legs, and the artery grafts tend to last much longer than the vein grafts. So for a very young man like Mr. Costa, who's literally wants to run marathons for years, this new plumbing on his heart is durable.
Verissimo made a full physical recovery, but mentally struggled with fears of another heart attack. Dr. Puskas, himself a runner, came to the rescue again. The two hit the pavement together, building up Verissimo's confidence. And now they're training for the New York City Marathon.
I can't even put into words. It's so amazing, and I'm so grateful to everybody.
We did 15 miles together a couple of weekends ago. We ran from here all the way down to the Battery and back. And he's going to be just fine.
The first one was 48.
And also making sure of that, their running coach, John Garlep. Back in 1967, the now 84-year-old won the race that later became known as the New York City Marathon. He also happens to be another of Dr. Puskas' grateful bypass patients.
5 valves he did.
He did what?
5. I told him I thought there's only 4. He says I did 5.
Now they're all preparing to tackle 26.2 miles together. Sandra Bookman, Channel 7, Eyewitness News.
So just for the record, there are only 4 valves in the heart, and Mr. Garlep had a 5-vessel bypass, not a valve operation, but he was indeed the winner of the New York City Marathon before it was called the New York City Marathon, and coached a group of runners that Verissimo still trains with. So tell us what you remember, Verissimo, about this whole experience, because this is a very different way to end up on the operating table compared to Mr. Diego. What do you remember?
Well, I don't remember much prior the incident. Like, it was a Saturday, October 6th, 2018. I was 42 years old. I was told that I left my apartment at 10 o'clock, and after running 8 miles, I just collapsed. 2 bystanders, they gave me a CPR, and I was in coma for a few days, induced coma, and I don't recall anything 24 hours prior the incident. So when I woke up at the hospital, I was a bit confused and groggy. Dr. Puskas, his team, Dr. Grossa, and they are talking to me, but I was really confused. I have no idea what's going on. And they didn't know who I was because I was running without ID or anything. So for 4 days, doctor?
5 days.
5 days, yes. I was there, and they gave me a nickname Lupus Unknown because they didn't know my name. But luckily, I was able to remember a friend's phone number, and they called her, and she contacted my family in Brazil. So my mother flew from Brazil. She stayed with me. The doctors, they waited until I got better to have my consent to do the operation. So they did 10 days later, I think on October the 16th, 15th. I had 4 grafts, all arterial, off-pump surgery. And physically, the recovery was fine, but mentally I struggled. I had a mild depression for 2 months, it went away on its own. And people, they ask me about the difference, like, oh, do you see, like, I honestly can tell because I was fine before the surgery. So I was like, quote unquote, like a healthy person, like no smoking, health diet, exercising. And so I cannot tell the difference, just like life is very similar to what it was before the surgery. I think those who like were struggling like before the surgery, they can see like greater like improvements, but I can tell. But of course, like life expectancy and preventing like having like future events, like heart events, like it helped a lot. But today, 7 years after the surgery, I feel exactly the same person, like, so.
So Dr. Torgos is the...
Oh, and by the way, can I make, the only difference that I would say is the 2 medications that I take, like one on a daily basis, like 81 milligrams of aspirin, and I take a monthly injection of Repatha to lower my cholesterol, which by the way was already fine, I mean, for like a non-cardiac patient before the surgery. And yeah, that's the only change. I didn't have to make any adjustments like diet or anything like that.
So Dr.
Mr.
Torgos
Costa,
is...
if I may ask you, so I'm David Taggart, I'm from Oxford.
Nice to
and
meet you.
Co-presenter of this meeting with my great friend and colleague, Dr. John Huskis. But I look at you, and if you walked into my consulting room, I say, here's a very fit young man. So do you have a strong family history of heart disease? Or was this just totally random?
No.
And the reason I ask you the question, the reason I ask you the question is, if it's happened to you, do you have brothers and sisters where you would say, okay, you're fit, so you were running 8 miles a day, I think you said, or 8 kilometers a day. So you're very young, active and fit. So you get struck by a bolt out of the blue. So how do you weigh, what do you make of that?
Well, I do have bad, quote unquote, bad genes. Like my grandfather on my father's side, he had a heart surgery, elective heart surgery in mid-80s. He was like early 60s. And my father, who passed last year, of like, he also had like heart surgery. He was like 55, elective. At the age of 55, yes. He had 4 grafts as well, here in New York City. But he died of cancer, not related to his heart condition. But they were like, they didn't have like a health lifestyle as I did. Like, they were like both like smokers, like, I'm from Brazil, so people like Brazilians, they love like barbecue. Like, oh, and by the way, I was vegan before like many years, like for 15 years before the cardiac arrest. I had been vegan, not anymore. So yes, I do have like history in the family. I have an older brother who also, he didn't have like a health lifestyle as I did. And actually, when people in Brazil, they learn that I had it, they thought it was my brother because, oh, he's the oldest one, like the chubby one. But no, he's the youngest one, like the yeah, the runner one. So yeah, that's.
So Dr. Torgos is the only surgeon on the stage who operated on both these patients, because he was my fellow in 2018, and he assisted at your operation.
I remember
and that's completely random, actually.
Yeah,
but
yeah.
that is true. Verissimo, we ran the 2021 marathon.
The 50th. The 50th, yes, because there was no marathon in 2020 because of the pandemic.
That's right. So it was the 50th running of the New York City Marathon in 2021. And then we ran the Brooklyn Half Marathon the next year.
Correct. May 2022.
Are you still running?
I'm still running, but I'm not planning on doing like an entire marathon. I find like half marathon more enjoyable. I just don't like the preparation for like the full like marathon, like the psychological like side of like and the anxiety. But yes, I'm still running. basic on a daily basis, almost like. Sometimes I
Marathon
don't.
happened how many weeks or months or year after the surgery? So you had the surgery
Surgery
in
was
18?
18, and the first marathon was 21.
21. And how did you close? Just because at this point I have to ask.
He did very
What
well.
was the close?
Not so well, like I think like 5 hours, but I took my time. I was still like a little bit scared, but like, yeah.
I don't know how many people here can close in 5 hours. I mean, I'm not sure I can close in 5 hours a marathon. So you did very well.
And I thought the courage of this man was remarkable. We were confident in our grafts, but on the other hand, we trained running along the same stretch of the west side where you had your cardiac arrest. How was that for you?
It was a bit intense because, as I said, I don't have any recollection at all of like the incident, but like seeing that, like was just picturing in my mind how everything happened. So.
Do you still run along the west side?
Yes, I do. Yeah, I do. I try not to remember. I just left everything like past. Like I try like for 2 months after the surgery, I was obsessed and learn as much as I could as a layperson. Nowadays with the internet, like you go there and you think like, and I was really depressed because some people, they build their lives around their careers, around like several things. I built my life about being like healthy and like emotionally and physically healthy. And when that happened, I thought, oh my God, everything that I did was in vain. Like it's just a sense of like a waste of time. But then like Dr. Puskas and all the nurses and no, you're lucky because like you feel like health, like status, like you're able like to come out of this like without any like damage.
And both our patients really very much have demonstrated resilience. Here we have Mr. Diego here 6 weeks post-op talking about the trajectory of his recovery so very early. And you, Mr. Costa, now 7 years, but with hundreds and hundreds and hundreds of miles of running under your belt since that time. We admire you both.
Thank you.
We work really hard to do coronary surgery, but I think sometimes we don't adequately appreciate how hard the patients work to recover from it in so many different ways, right? Physical, mental, emotional. Right?
So,
Dr. Subramanian.
Short question. I think you're on Repatha. Is it controlling your cholesterol level
It is.
and triglycerides?
As I stated before, my cholesterol, like for a non-cardiac patient before the surgery, was fine. I was taking at first, not Crestor, Lipitor, 20 milligrams. Then I went to Crestor, like 10 milligrams. And then like 4 years after that, like I was just like feeling like my energy levels like very low. I complained with my PCP and he told me, oh, check with your like cardiologist if you can change or anything. So then I did something bad. I just decided to stop with like the Crestor by myself like for a month and I felt like better. So my PCP was able to get like a pre-approval for Repatha. And I take just once a month because my cholesterol goes like very low. At first I was taking like twice a month, like every 2 weeks. But now it's just like once a month.
So may I suggest to you that I think you have a familial hypercholesterolemia from what I know in the history. And you probably already need some sort of a gene analysis because somewhere along down the road, the Repatha may fail. Then he may be qualifying for any of the new coming trial with the scriptor gene editing drugs. You know, I think you ought to be prepared for that. I know the arterial grafts will be fine, but I still think that you are at a high burden for further events. So I'll strongly suggest from an old man like an 86, I can tell you that you will have to have some gene mapping.
Oh, thank you. Can I just tell one more thing? Like 5 years ago, I had a nuclear stress test, and all the like native vessels and the grafts, they're totally fine.
Yeah, very good.
You had the ultimate stress test 3 years post-op running a full marathon.
Yeah.
And then coming to my place.
I just want to lift you up
Can I
a little bit.
please say to both
Let me just lift him up a little
Sorry.
bit, because I think the intention was right, that you need to be on maximal medical therapy. But
Yes.
I know lots of people. I come from a part of the world where they have horrible genes for coronary disease in the Middle East, and many have cabbages in their 30s and 40s. But many go on a trajectory that's similar to the general population, age match, life expectancy, especially if they have multi-arterial grafting. So don't worry.
Excuse me, is this a thing? Because my mom, like, she's of Middle Eastern descent, so I
Yes,
didn't know, like.
that's a risk factor. But
Thank you.
I just
Can
learned that.
I think you're protected, and I think you're going to live a normal life expectancy, but maximize your life quality of life, because if you get disease, it's going to be in a small vessel. If you want to minimize that, you maximize your medical therapy. So the best of both worlds. Okay.
Can I say to both our patients, you're not allowed to call people patients. We have to call them clients. But to both of you who have come here today, enormous thanks to you. And to both of you, if I look at what has happened to you both, there is a word in Arabic which we don't quite have in English called inshallah.
Yeah.
So to both of you, God is willing, and I'm absolutely delighted that you're both here today, you're both alive, and you were both treated by expert surgeons. So, inshallah.
You're going to be a greatest taxpayer, no worry. for a long
Simply
time.
want to congratulate both patient and doctors. I just briefly introduce my patient in the homepage. He who ran 6 full marathon after my arterial open bypass in Japan. So you probably have all friends all around the world, treated by the expert. And the final marathon was in the United States, Honolulu. He ran the great marathon. Just for your friend, maybe your future friend. Thank you very much.
Thank you, Toru. Dr. Asai. So thanks again to Mr. Costa and Mr. Diego for coming and sharing your very personal stories. On behalf of all of the attendees here at the 11th Annual International Coronary Congress, thank you for being willing to bare your souls, your hearts, your experience, and share that with all of us. I think we're all much better for it. Thank you.
Thank you.